The video Chasing Zero targets preventative healthcare mistakes that cause harm to our patients. The idea of Chasing Zero was to hopefully begin to inspire change in the healthcare system that we utilize every day. The goal was to reduce the preventable healthcare mistakes that cause harm to our patients to zero. This can be accomplished by improving best practices, leadership, and technology. The concept of Chasing Zero incorporates many individuals of the healthcare team, including caregivers, such as doctors and nurses and pharmacists, healthcare leaders, such as hospital CEOs and facility administrators, and most importantly, the patient or healthcare consumer being negatively affected by the healthcare mistakes. My first impression of the video Chasing Zero was shocking. It was shocking because many of the preventable mistakes that have caused patient harm are things that as nurses we still do today. For example, as nurses, we work long shifts, we work double shifts, we work short-staffed, and we often are overloaded with patients. At times, the double check system for administering medications is not utilized simply because we are short on time and it's time consuming, or the double check system simply does not exist in our workplace. An example of a preventable mistake that caused harm within the facility I am employed occurred when an agency nurse inadvertently mixed up the medications of two patients with the same first initial and identical last names. One of these residents was not prescribed narcotics, and the other resident was prescribed morphine scheduled. The agency nurse administered the morphine to the incorrect patient, and the patient had a morphine allergy. This patient did have a reaction, but was stabilized at the hospital. We were able to send her out, and she was okay. But this mistake is 100% preventable. If we had a double check system consisting of scanning the medication barcode on the package and the patient's barcode on the armband, just like in a hospital, this would not have happened. It has been 6 years since this incident, and we still have not implemented this technology within our long-term care facility. Chasing Zero should be a priority for our facility. It is the responsibility of every healthcare professional to do the double check, to call out a broken system, to request improved technology. And by doing this, we can and will save lives.